Good afternoon, North Dakota. State Director Josh Askvig. With me is Janelle Mose, and we are with you on a Monday afternoon for the AARP North Dakota Legislative Lowdown. I want to just take a second and thank, first of all of our volunteers. As most of you probably know in the room, we are simultaneously in technically five different sites, because we're here, and then in 4 different sites today to spend a little bit of time talking about what's happening at the North Dakota Legislature impacting North Dakotans 50 and older. So thank you to our volunteers. Hopefully you get a chance to say thanks to them after the event is over today. With that, Janelle, we're used to doing this on a Friday, so it's a little bit different to do it on a Monday afternoon. How are you, first of all?
Well, I'm good. I got to see all the volunteers up in and the attendees up in Bismarck. It's good to see all of you. I'm sure you're like, whoa, she was just here a little bit ago. So yeah, no, it was great to see so many excited people in the room and ready to go and learn more about what's going on at the legislative session. That's great.
Appreciate it, and appreciation again to my staff as well as we have someone from our regional office helping us out in Grand Forks as well. So great to have and great to be here. Janelle, before we get into kind of the slides and kind of what's happening, so I don't know that I posed it to you this way last week when we were kind of talking about this, but give me maybe like one sentence or one phrase that kind of encapsulates the North Dakota legislative session thus far.
I would say busy and new.
Busy and new. Okay, so busy being?
Busy because, I think the excitement of a legislative session is always that way, but I think it was busy because there were a lot of new pieces of legislation that people were considering, and there's so many new staff, legislative staff, there's new legislative council staff, there's new legislators. So with that comes a busyness of people being excited about the process and learning about the process, but there's so much newness and so much to learn. So I think that really came at us super quickly.
Yeah, if you were to ask me that in reverse, I would have said it was bumpy. It was keep your seat backs up and tray tables in a locked position for the first couple of weeks. And then after that, we kind of got into cruising altitude and it kind of felt a little bit more normal. And I think you highlighted the reasons why. There was just so much newness in terms of 41 new legislators, a bunch of new staff, et cetera. And I think it's important for those of you listening to understand that colors the whole session. I mean, that colors how bills get debated. I mean, we were expecting to have our bill heard the second day of the session, and then that got moved, and so we're having to pivot as we do that. With that, let's get into kind of that, and we kind of it started on this, but maybe give folks kind of just a high-level overview of like what's happened so far in the legislative session in terms of by the numbers and mega scope of what's going on out there.
Well, I think bumpy is a good word because the Legislative Council got a new website as well. So those of you that know of us that really like to dig in early, those bills weren't there. So I think that was what was a little bit bumpy too, that the legislative website was slow to upload some of the legislation. But what we finally got it rolling, there were over 967 bills that have been introduced this legislative session alone. And that's not a record, but it's super close to a record number of bills. And so if you think about it, there's a lot of nighttime reading, right? And light reading on the side to go through those bills. But what we know,
reading.
light reading, right?
Different definition of light reading than I have.
Yeah, I don't do a lot of light reading, so that was my light reading. But over 559 bills in the House, as you can see on the screen, 408 in the Senate. So a total of almost 1,000 bills. And granted, we at AARP don't track all of those bills, but I think what you need to know is that of those 967, we were at one point in time tracking 150 bills.
Yeah.
So that's a lot to just kind of, sort through and figure out, are we gonna talk about that bill, or are we gonna, testify on it, or are we just gonna track it and see what it does? And a lot of the first session is just, waiting and seeing and learning about what the bill's about and learning about what the sponsor's intent was. So what we know right now is that there's still 768 bills active in the session. About 200 have failed so far. And there's about 45 days left in the session. So we're right at that halfway point.
And I think I read at least the Senate Majority Leader is going to try and push them to get done 7 days early than their 80 constitutional days. So it's going to be fast and furious, and we'll talk about that in a second. Mm-hmm. I do want to take a minute to just remind you, if you have questions for us today, we are taking questions, and we're going to do Q&A at the end of our presentation. You should have a note card on your table somewhere. Fill out your question on there, get it to one of the volunteers in the room, and they'll get it to the appropriate person to get the question fed to us when the time is appropriate. And in addition, if you don't have your bingo card out, you can already check off legislative website. You can check off 80 days, those types of things. So looking forward to that. Janelle, let's also just remind folks, you talked about 100 and 150 bills that we were tracking. But when we looked at this, we really went into the session with kind of 4 big priorities. Do you want to kind of remind folks what those 4 priorities were?
Sure. Our number one priority is lowering the cost of medicine. We hear from folks every day that they really have to make difficult decisions. And so that we went in laser focused, that we were going to try to find ways to help lower the cost of medicine for you and family members. The other one we hear a lot about is helping prevent fraud and exploitation. That's a number one call that we receive from folks that, is this real? Is this not real? Should I send money to this person? So we want to find ways to really try to prevent frauds and scams. And then the other thing we hear about, you want to stay in your home longer as you age. And I think I talked to several volunteers and members up at the Bismarck location today that's a thing that's so important to them. How can I stay in my community? How can I stay in my house longer? So we want to make sure those services and funding is available to support that. And then the final thing is retirement security. We know that, that's one of our main focuses at AARP, not only here in North Dakota, but across the country. We want people to be secure in their financial resources as they look at retirement.
Yeah, absolutely. And let's just dive into each of them. And let's start with, as you mentioned, it's our biggest priority heading into this session, lowering the cost of prescription drugs. There's really been 2 bills we're following. Let's start with Senate Bill 2031. Senate Bill 2031 was kind of our big bill, and maybe kind of just give folks a little bit of the history of where this came from. This actually goes back to last session as part of it. And so maybe just kind of outline the history of how we got to the session, and then we'll jump back in from there.
Yeah, I think if folks think that it's usually one and done, it's not. Some of these issues are longtime friends, is what we call them at the session. So 2031 was actually a bill that Senator Howard Anderson, who's retired now, introduced last legislative session. It was really to look at, instead of importing drugs from Canada, let's look at the prices. We know Canada pays far less for medicine than we do here in the United States. So it was a bill that was to look at how can we import prices and try to push them down on those prices and say, you know what, we are only going to pay this. So it started back in the last legislative session. It got turned into a study. And so the Interim Healthcare Committee actually studied this issue for the last few months. And there were meetings every other month, usually with the Interim Healthcare Committee. They were considering lots of different ideas. There was some bills in Montana they were looking at, other bills from across the country. But, Representative Lisa Meyer from here in Bismarck really latched onto this idea that she thought Senator Howard Anderson was onto something. But what we did was we really narrowed the scope of his bill. His bill would have looked at 250 drugs, saying, hey, we're going to look at 250 of the most costly drugs in the United States. Why should we pay more than what Canada is? Let's import those prices here. She latched onto that, but she thought, let's kind of narrow the focus even more. We know that North Dakota doesn't like to usually be the first out of the gate with some of these issues. So she said, let's narrow the focus. Let's look at 25 of the most costly drugs, and let's just narrow it to PERS, or the Public Employee Retirement Insurance Plan.
Why did she want to narrow it to PERS? I think that's an important distinction for our folks to understand. And we're going to talk about this when we get to the insulin cap bill in a second as well.
A lot of new ideas and new initiatives get run through PERS. It's the state employee, health insurance plan. It's easier to kind of monitor and track, and you've got, a way to really try things on before you make it broader into that public health insurance market. It's a way to test things out. And that's really what the intent behind 2031 was really a pilot project to try this on. Unfortunately, as everything that we want, it doesn't always happen, right?
I believe the song is, you can't always get what you want, right? Isn't that what it is? So that went through the interim. It was forwarded to the full session. It started in the Senate and went to the Senate Human Services Committee. First of all, kudos to Kathy Schwan, our volunteer state president. She did a marvelous job, as well as Bob Entringer, who's a volunteer from here in the Bismarck area, providing testimony. There were also a number of volunteers in the room supporting the effort when we had that hearing. I thought they did a marvelous job of testifying in support of 2031. In that hearing, though, we heard some pushback about not wanting to use Canadian prices as a reference rate. I don't think we have time to get into all of those details, but one of the concepts we were asked to go explore was attaching it to Medicare negotiated rates. So maybe just talk about, after the hearing, what happened, what went forward there, and how did we get the bill, what happened to get the bill out of committee?
Yeah, a lot of people think that for that hearing that everything ends right there, but that's just the very beginning stages. So there's a lot of work that happens in between the actual committee hearing and when the committee either considers amendments. So what we did was we worked really closely with a couple of senators to say, so if there is concerns about this Canadian reference price, we know that Congress just passed a law to look at Medicare negotiated prices. Why don't we have PERS try that on? Mm-hmm. It's going to be a federally published, and it's only limited to 10 drugs. So we worked really closely with a couple senators, amended the bill, which in policy wonk terms, we essentially hoghoused the bill, which we
were trying.
We tried to hoghouse the bill so it would look completely different from how it was introduced. But all along the way, we kept, Representative Meyer, who was the lead on this, as well as the chairman of the committee, both on the House and the Senate side. And the communication is so key during the legislative session because things get moving super quickly. So we amended it, brought it in front of the committee. You actually walked the committee through the amendments in the bill that, again, would have changed it to those 10 drugs that will be Medicare negotiated price drugs, again, limited to PERS. Unfortunately, we weren't successful, right? We got a couple of senators to vote in our favor, but ultimately we were not successful in getting those amendments adopted. So after the no adoption of the amendments, it goes back to the original bill, which was the Canadian prices, and unfortunately came out of the committee with a do not pass recommendation, or not what we were looking for. But.
Yeah, and I think that is just a testament to the fact that I think we put in a lot of hard work. It was regrettable that the committee did not adopt the amendments. I think that would have might have had an influence on what happened in the Senate floor. The bill ultimately went to the Senate floor. We did get 14 yes votes. However, we didn't get enough to get it over the hump so far as part of it. And I think this is a good reminder for folks that the legislature is still in session until they adjourn, sine die. And so we're still working on other ideas in ways to continue to try and put downward pressure on prescription drug prices in North Dakota. So unfortunately, 2031 didn't work, but that doesn't mean we're giving up as part of it. And I think it leads into a little bit of probably what happened with Senate Bill 2041 in a second. Anything else you want to talk about on 2031?
We wouldn't have gotten those 14 votes without the 450 plus emails that were sent by many of you that are probably sitting in one of our 4 locations. We had 450 emails that were sent between January 2nd and February 3rd, which was the day that they voted on the bill. So none of this work can be done without folks, telling senators that this is important to them.
Yeah, absolutely. And I just want to say thank you as well. I think that's really important. And thank you for that reminder. And if you're not getting those emails, there's a flyer on your table that will show you how to sign up to get those emails going forward. With that, let's quickly touch on Senate Bill 2041. I find this interesting because this bill also came out of the same committee with a very strong do not pass recommendation. But I think there was some spillover effect from the pressure that you all put on 2031, the work we were doing. That bill got flipped on the Senate floor ultimately. You want to just give a little highlight about what that bill does and what happened there?
Yeah, this is another old friend, as Senator Mathern from Fargo would say. He introduced this last legislative session. It's something that comes up periodically. Again, this was to look at capping the insulin prices as well as the medical supplies that we know so many folks are relying on in terms of managing their diabetes. So this was a bill, again, that got a very strong do not pass. You see that they almost doubled the votes on the Senate floor. But what it does, again, it narrows the focus. It's going to narrow it just to PERS. To see what's going to happen. Can we look at capping that price? Can we look at managing those medical supply costs? And if it does, there's language in that bill that asks PERS to actually study the issue and introduce a bill next legislative session that would really expand that beyond into the private market. So this is a huge step forward. It might seem small, but it could really have big impacts long term for not just the cost of insulin, but other drugs.
Yeah, absolutely. And Senate Bill 2041 was one we had weighed in support of as well and really done. I know a lot of you are aware, obviously we're working on prescription drugs at the state level. We've also been working on it on the federal level for a long time, including scoring some very big wins in Congress last year around prescription drugs. And many of you may be aware of those prescription drug wins, but for those of you who are not, we have a little bit of a video to show you and provide you a better understanding.
Number one, and importantly, requiring Medicare to negotiate certain drugs. This is something AARP has been fighting for decades. Second, capping out-of-pocket costs in Medicare Part D, which in 2025 will be capped at $2,000. Third, penalizing drug companies that raise their prices higher than the rate of inflation. Fourth, importantly, capping copays for insulin in Medicare at $35 a month. And fifth, for Medicare-approved vaccines, In Part D, those vaccines will now be available at no cost to seniors.
So hopefully you get a sense of how important prescription drug price relief is for AARP, again, not just at the state level, but also at the federal level. And talking to our friends on the federal GA team, I know they're continuing to work on making sure that law gets fully implemented and protecting against pushback against that. So in addition, Janelle outlined we have 4 priorities. And so let's talk a little bit about another priority, which is helping to prevent consumer fraud and exploitation. And admittedly, this is a new area for us in the advocacy realm. We do a ton of consumer outreach and awareness in this, but in the advocacy realm, this is a little bit newer for us. And so why don't you tell them a little bit about what I think is probably our biggest success thus far in the legislative session, and that's Senate Bill 2325.
And I feel a little bit at home in this issue, right? You know that I spent almost 20 years doing victim advocacy. So this is near and dear to my heart. We know that, there are folks that are victimized by criminals every day. And so again, this is a big win. And this actually started, if you remember, we had AARP on Tap events last year before the session started. And Senator Judy Lee brought this to our attention, that this was an issue that she was really invested in. And so she connected us with Commissioner Tyler.
From the North Dakota Securities Commission office.
Yeah, so we were really interested in this. And again, this started small. We wanted to just have a conversation about what is the Securities Commissioner seeing and what are small steps that we can take to start to address some of the crimes that are happening out there. And so Senate Bill 2325, as you see on the screen, again, was a huge win for us. The committee really thought that this was a great idea. And again, it doesn't make victims whole, right? We know that a lot of you are potential victims of financial crimes, but it creates a victim restitution fund, and it'll be limited to the financial crime victims. And it's going to start to look at how can we start to provide some remedy, some relief if you've been victimized. So it's a small step forward, but a huge win for financial crime victims.
So talk a little bit about the parameters in that bill, because I think that's really important as you all understand this bill and want to put pressure on legislators regarding this bill. The bill is crafted to be very narrow in scope. It only applies to securities or investment-related fraud. There are caps in the bill. Do you want to talk a little bit about the caps? You mentioned it doesn't make people whole, but just touch a little bit about what those caps are.
Yeah, it does cap the amount of money that's available to victims. And again, that was to safeguard the money. There's $1 million that they're going to appropriate in this bill over the biennium. And it does give them some freedom to put some more money into the fund, but each victim's limited to a certain amount of it available to them. And they'll have to make, an application process. They're going to work out some of the details after this, right? The big picture goes into the statute. And then after the bill is passed, which we hope you'll continue to push on your folks in the House to get this bill passed. But then they'll start to really work out the details about how do we get this law on the ground? How do we make people aware of it? And then how can folks get access to that if they have been victimized?
Yeah, absolutely. And I think it really also is another tool in the toolbox for the North Dakota Securities Commissioner to go after these bad actors, especially if they're not affiliated with larger firms and whatnot as part of it. So big win so far there. However, we think this is going to be a little bit tougher climb in the House. And so we're going to need folks to weigh in on this, watch for more either on our weekly Friday All Things advocacy updates, or again, if you're not getting our advocacy emails, there's a flyer on your table on how to sign up and get those advocacy emails to make sure you can put pressure on your legislators about that. In addition, we have something we're watching in the Attorney General's budget related to the Medicaid fraud unit. And North Dakota became the last state actually that stood up a formal Medicaid fraud unit. You want to talk a little bit about what we're watching in the Attorney General's budget?
Yeah, this is for folks that don't like to dig into the policy, the numbers side of things, right? And some people think that's a pretty dry area, but this could be kind of an exciting area. I still remember my dear friend, former Attorney General, Wayne Stenton. This was an important issue to him. He moved that piece forward. What it does was, we know that they become really busy, right? And they're understaffed at this point in time. They've only got a total of 4 staff. I think the Senate heard them and said, wow, you've really done remarkable work. And they added some additional staff there. So it's really going to bolster their ability to look at when there has been fraud happening for Medicaid and start to, do more investigation, more prosecution of these things. It's really hard to come by additional staff right now.
Yeah,
the legislature's at a point in time, they're really trying to balance things out. What are their priorities? Right. But the Senate really said, this is a priority for us as senators and in the Senate Appropriations Committee. We want to make sure the Attorney General's office have the staff that they need to go and do their work and do it well.
Yeah, absolutely. I think that's so important as part of it. And so again, a newer area for us, helping to prevent consumer fraud and exploitation in terms of the advocacy. But as you know, and as I think many of you watching know, we've done community outreach and community engagement around fraud and fraud awareness and scam awareness for a long time. And we wanted to provide you with a few quick tips on how you can spot older adults that might be at risk.
Financial exploitation costs older adults billions of dollars every year. To protect your loved ones, be aware of 3 ways that they may be at risk. Are they trusting by nature? Elder financial abuse can be committed by a stranger, but it's more often committed by someone they know and trust, including family members. Do they feel insecure about their money skills? Older adults who aren't confident in how they manage their finances might turn to someone who can help them. This can lead to exploitation. If possible, help your loved one find a trusted financial advisor or someone who will put his or her interests first. Fear of being judged can prevent victims from admitting it's happening and can put them at future risk. It's important to understand that victims have done nothing wrong and to convey that to your loved one. For more scam tips, go to aarp.org/fraudwatchnetwork.
We so appreciate our friends in the AARP Fraud Watch Network. They do a wonderful job staffing a helpline and helping folks understand what it is, and also providing us with resources and information to help you all spot scams and fraud related to older adults. Just a quick reminder, if you have a question, there should be a note card. It looks something like this. Well, mine is white. Yours might be a different color as part of it. Write your questions on those note cards and get those to the volunteers in the room. They'll feed them up front to get them in the queue. And those of you who are feeding questions into the queue, you can go ahead and start putting those in so we can, when we get to there in a few minutes, have them ready to go and take advantage of that time. So do that. With that, Janelle, let's talk about, we have 2 other priority areas that we want to make sure we touch on and kind of give folks an update about before we get into the question and answer portion of it. And you mentioned that, I think you did a beautiful job outlining this in the intro when we were kind of talking about the overviews. If we asked the question right now and said, those of you in the room, raise your hand if you want to stay in your home for as long as you can safely do so, I would have a bet that if somebody wasn't raising their hand, it was because they either didn't hear the question or they may not be able to do so. Because I know this is a conversation I was having just this weekend with my folks when we were up visiting my folks as part of it. I know we talk about it all the time here, even within our office as part of it, and we hear about this. And so there are a number of things, and we're going to probably go through these a little bit rapid fire because it's so much and so hard to try and absorb. But I think it's important folks know. The first is kind of the biggest area of focus for us around home and community-based services is around the Department of Human Services budget. And the reason of that is they're often the ones who end up providing the resources in terms of either money, staffing, or information around providing services when older adults need long-term care support. So can you just give a couple of highlights of items we're watching in the Department of Human Services budget and what we've advanced the ball on thus far in that budget?
Sure. I think the pandemic really shined a light on several issues that really, have put a money crunch, right? Have been really challenging for folks. And so what we really weighed in on in the Department of Human Services budget is looking at meal assistance, both in home, out of the home. What the Senate said was, yeah, wow, this has become, we haven't given increases in quite some time, both for congregate meals or for home delivered meals. And so they said, we really need to bolster that. We need to give some more money so that, again, if that might be the only time someone gets a warm meal in their home. So we want to make sure that the money's available to get that delivered to them, helps them stay healthy, helps them stay in their house. The other thing is we know, electricity bills, heating bills have gone up. So we really said, hey, we need to increase that availability of the federal money, make sure that the state can get that money on the ground, which is LIHEAP or the, heating assistance. We want to make sure that you can eat, your home is, nice and warm for you to stay at home. Those are 2 big issues that we really weighed in on. And the Senate said, yeah, we need to put some money available there. So.
Yeah, in addition, I know we testified in support of the 68,000 plus caregivers that are doing that uncompensated care every single day in North Dakota, providing additional enhancements to the state payments for the elderly and disabled program, some additional enhancements to long-term care workforce outside of a nursing home setting, Nursing homes are great. They have a role in do that, but we also need to be supporting and building workforce for folks to provide that care in those home and community-based services setting. And I believe we also weighed in support on some additional resources for the Alzheimer's Association to do some additional caregiver supports as well. Yes.
Yes, and they were successful in getting some additional resources. So that's a big win on those three areas. We're going to watch that as it crosses over. Actually, it's this week. They're going to do an overview in the House Appropriations Committee, where they're going to hear what the Senate decided was a priority for them, and then they get to decide if that's a priority for them on the House side. So
yeah, we'll see if we can get anybody a bingo here on this, because the next one we're going to talk about is the Housing Incentive Fund and the Industrial Commission budget. Let's maybe quickly remind folks, what is the Housing Incentive Fund, and then what are we watching in the Industrial Commission budget related to it?
Sure. The Housing Incentive Fund is a fund that's available to make sure that we have affordable housing. We know that, there's a lot of building and there's a lot of booming across the state, but we also know that the market is pretty narrow, and we know a lot of folks aren't seeing affordable housing come online. And we know from a recent housing needs assessment that was done through the Housing Incentive Fund through the North Dakota Housing Finance Agency alongside NDSU, the 65 plus population is growing. And it's growing rapidly, and we want to make sure that there's funding available for affordable housing. So in that budget, you'll find the North Dakota, I just forgot who they were called.
The North Dakota Housing and Finance Agency budget,
yes,
which has the Housing Incentive Fund dollars.
Does.
And how much money did they put into that?
Right now, there is, I just lost it.
I think it's about 15 million.
It is 15 million. They had requested 25 million, right, but there is 15 million available there for to support building of low-income housing. So,
and you all just got a picture as to why Janelle and I work so well together, because there are oftentimes I will forget things that she can fill in the details on, and she forgets things that I can fill in the details on, and is part of it. So with that, let's jump also in the area of home and community-based services. There's been a lot of talk about taxes, tax relief, tax buy downs, whatnot, and we've stayed out of the big tax fight thus far between income tax relief versus property tax relief in terms of the overall picture of buying down mills or putting the money towards income tax relief. But we have weighed in on an important, what we call circuit breaker program around property taxes, because we know and have heard that folks are concerned about property taxes. So there's two bills, and they are different in scope a little bit, but they essentially both do the same thing. So do you want to talk about what 2136 and 1211 kind of aim to do and why we weighed in support of them?
Well, it's funny, legislators will look at you and they're like, why are you sitting in finance and tax, Janelle? But this is, again, a huge issue. What we've heard from folks is that I've got my house paid off, but my property taxes are so high, I cannot pay my property taxes. How am I going to stay in my house? So this is a tax bill that we follow both in the House and the Senate. As you can see on the screen, this is widely supported in both chambers, and it's gotten a lot of groundwork. What it does, it expands the eligibility, so more people will be eligible to apply for this tax credit. It increases the amount of the tax credit. So this is a huge thing for those of you that are still living in your homes, in your communities. This is a tax credit that's available for you to apply for year to year. And so we want to encourage folks, not only to encourage the Senate and the House to pass these bills, and we know that both of these bills likely won't pass. Right. There'll be a point in time that they'll cross over, and they'll probably merge these issues together and find a total dollar amount or a tax break that they agree to. But this is a huge issue, and we want you to know that it's available and know that the bill is moving forward in both sides. So
yeah, absolutely. And I think it's just important to know that the beauty of the homestead property tax credit program is that as your ability to pay property taxes goes up, your relief goes down, and as your inability to afford those property taxes goes down, your relief goes up. And so it's really a targeted, measured approach that looks at that affordability as part of it. In addition, we know it's tax season, and as part of tax season, we want to make sure you're aware of the homestead property tax credit as a resource. The North Dakota Tax Commissioner's Office has a brochure with more information about what the current rules and regulations are around qualifying for the homestead property tax credit. You can find that brochure and that information at tax.nd.gov/homestead. Again, that's tax.nd.gov/homestead to make sure you're taking advantage of that homestead property tax credit if you qualify, and encourage you to do that. You can also, if you have questions and you can't get to the tax commissioner's website, check with your local county auditor where you live. They would also have information about how to access that program as well. With that, Janelle, let's jump to kind of the fourth priority in our four priorities. And they're not, I think we know prescription drugs has been number one. I would kind of bundle the rest of these and they're all equal weight as part of it. But one of the things you talked about is we support retirement security, and that really comes from our founder, Dr. Ethel Percy-Andrus. She founded what became the National Retired Teachers Association, which ultimately then morphed into a larger group called AARP, as we know it today, because she found a colleague of hers living in a chicken coop because her retirement security was so poor that she couldn't afford anything else. And so out of that, as part of it, and one of the things we believe in is making sure that we sustain and support and build retirement security, not tear it down. So we've weighed in this session around kind of two specific bills related to public employee pensions as related to it. And let's maybe talk first about the one that we're opposed. We've been supporting a lot of things. If you haven't been following along, pretty much everything we've talked about is stuff that we've been actively supporting. We haven't spent a ton of time opposing things, which is a good place to be in for the most part. But we did and have weighed in opposition to House Bill 1040. And you want to tell folks a little bit about what 1040 does and why we're opposed.
And 1040 was studied during the interim. They actually created a new committee called the Retirement Committee that studied this issue. This has been a long-standing issue that the legislatures really get their hands around, trying to figure out how can we look at maintaining it. And so for those of you that have your bingo card in front of you, defined benefit, those are pension plans. Defined contribution, those are like your 401k plans. So a lot of people hear those two things and you might hear it as a DB and a DC. So there's maybe some more bingo slots on your card. But why we've been weighing in and opposing this is because we believe that we want to protect the security of workers that are currently vested and or nearing retirement. And what 1040 does, it eliminates that ability to have that defined benefit or that pension plan. And we don't feel that that's really a place that we think that the state should move to. We stand with several other organizations that think this really for the long-term retirement security of folks that are currently vested or nearing retirement, this isn't a good plan. 1040 is not a good plan.
Yeah, and I think it boils down to, admittedly, I will say I credit the bill sponsors for they're only applying the change to new employees going forward. It would start in 2025, I believe, is the last look that I had at the bill. But the concern is if you start taking that funding stream out of the fund, making sure that fund gets fully back into a healthy status to pay those benefits that they've promised, I think is a long-term concern, and a concern about pushing off that decision to future legislators as part of it. And so I think that we've weighed in opposition to that bill. That bill did pass the House of Representatives by quite a wide margin as part of it. I think one of the other reasons we've weighed in opposition is there's a significant cost to the state in doing so that we think is a much larger cost based on different analyses we've seen than the other bill that we'll talk about here in a second. And it really boils down to, in our belief, ensuring those who have retirement security maintain access to that and that it stays secure is a concern for AARP and older North Dakotans. And so that's why we've been pushing for that. Let's jump to a little bit different approach. So that was the House approach in the first half, passed the House, and we'll move over to the Senate, and they'll have that bill in the second half. The Senate is taking a little bit different approach, and talk a little bit about Senate Bill 2239.
Sure. Senate Bill 2239 was introduced early in the session. Senator Cleary and Senator Dever really felt like this was another option, right? You often see two different bills that have competing ideas, but they felt it was important to put a bill forward. And so what this does is fully fund the defined benefit plan. So it retains the defined benefit plan for both current and new employees, but it also gives new employees the option that if they don't want to go that route of having a pension or defined benefit, they can have the option of opting into a defined contribution plan or like a 401k plan. Again, this was supported in the Senate. I think it looks at how can we make sure that the state stays right with the obligation of folks that are currently in there. It puts some what they call cash infusions into these bills, so they make sure that pension plan stays whole. So I think it gives an alternative and another talking point, essentially, to say this isn't just a one and done. There are lots of options that the state can stay right with their obligations, but also look at how is the state going to find a way to recruit, retain, and make sure that state employees, are offering the services that so many of you rely on. And I think so, 2239 really gives a second option for consideration.
Yeah, absolutely. I think the other thing to just note, and you kind of touched on it there, is with a lot of discussion happening around workforce, I think making sure that and I know this from my prior experience, having been in different positions, that defined benefit is a great retention tool in terms of workforce, and with the state struggling to recruit new workforce and then wanting to retain them, certainly something to consider. So that bill passed the Senate. That'll go over to the House. I believe, this is Josh talking, that this is probably one of two or maybe three issues that is likely going to be one of the last issues resolved. As you can see, there's two very different approaches coming out of this. They're going to have to be resolved before the legislature adjourns sine die or for the end as part of it. So I expect a lot more to come on this as part of that. So those are the four big priorities. We've talked a lot about that. So let's talk about what comes next. What happens now? The legislature's on what we call crossover break. They wrapped up last week, Wednesday, I believe, is when the House finally finished its last bill before taking this little bit of extended break. What happens now, and where does the legislature go from here?
So you're right. They're off today and tomorrow. They'll be back in the Capitol on Wednesday, on the 1st of March. Can you believe it's already March? It doesn't feel very well. It feels.
We have 2 more days of February, today and tomorrow.
It feels tropical in Bismarck. It's
Yeah.
in the 40s today here in Bismarck. But they come back on March, and so what you see is we just start the process all over again. So all the bills that passed in the Senate will now be heard by the House committees and vice versa. And what you'll see the first 2 days, so Wednesday and Thursday, is really dedicated just to committee hearings, budget overviews. There'll be a lot of committee hearings where they'll start to hear bills from the other chamber, but they won't actually gavel in. They're not going to gavel in for the House or the floor session because of the break. They don't have a lot of bills to consider on that House or Senate calendar. So it'll be just a lot of sitting and listening. And then on Friday, they'll gavel in to start voting on bills. So we expect it'll be a slow, but it'll pick up pace really, really quickly.
I think it's going to go really fast once they get rolling here again. I think it's important to now understand anything that was passed by the House now goes over to the Senate for consideration. And so if you've been hearing us talk about HB or SB, that's House bill or Senate bill, during the first half of the session, if it was a House bill or HB with a 1 and then some numbers behind it, that was in the House, those now go to the Senate. The ones that passed, the ones that were defeated are done unless they come back in some other form or shape or get amended onto something else. The Senate bills, vice versa, they're through the Senate and now go over to the House for that consideration as part of it. That process, at least according to the Senate Majority Leader's quote, they're going to try and get that process wrapped up sometime that first or second week of April. I mean, so that's going to be a big push.
Yeah.
What happens when there's disagreements between the bills? Then just maybe touch on that for folks.
Sure. So if this House bill started, for example, in the House, it goes over to the Senate. The Senate has the opportunity to amend a bill or make some other changes to that bill. So then if they vote on it and approve it in committee and it's approved by the entire Senate, it goes back over to the House. And then the House can decide whether or not they approve of the changes the Senate made to that. And if they do, then they'll go ahead and vote on that and approve those. But if they don't, then they can create what are called conference committees. And so you get 3 members of the House and 3 members of the Senate that'll go together. And the Senate, since they amended the House version of the bill, they'll walk the House through what the changes were made. And so they can either then make other changes or find some way to agree. So it's really a lesson in mediation, right?
Yeah.
And
negotiation.
Yeah. A lot of people think you can't disagree. But I think there are a lot of disagreements. But what's great about this process is they got to sit in a room and they got to decide what can we agree to and what can't we? And then how can we find a bill that's the best bill to move forward to get passed by both chambers and then ultimately signed by the governor?
Yeah, absolutely. As part of that, I think a good reminder. And if you forget all that, don't worry, because every Friday, Janelle and I do this every Friday, a much condensed version of this. This has been a little bit long as part of it, but we do this every Friday at 2:30 p.m. For our All Things Advocacy Update. We give a weekly recap of what happened the week that was. We also then do a preview of what's coming up the week ahead in terms of our All Things Advocacy Updates. You can find those on our YouTube channel, our AARP North Dakota YouTube channel. I believe there's also a handout on your table that allows you to do that. One of the things, I'm just going to give you a preview right now. We're about to switch into question and answer as part of that. I can tell you, because I've seen some of them populating behind the scenes here, we're probably not going to get to all of the questions and answers today. And just knowing the week that is ahead of us in the North Dakota legislative session, Our plan for this coming Friday at 2:30 is to do what I would call a mailbag episode, or to take some of those questions that we're not able to get to here in the next 15 or so minutes and try and provide some answers for those for you as well. But if you're not watching All Things Advocacy at 2:30 on Friday, I encourage you to do that. If you can't watch it at 2:30 on Friday, have no fear. You can go to the AARP North Dakota YouTube page and find the recording of it there. You can actually go all the way back to the beginning of the session. Our intern Haley has done a marvelous job, along with Marnie, in categorizing those in a playlist. So if you really wanted to follow and track what's happened in the session, you can go all the way back to January and actually to December pre-session and watch everything that's happened thus far as part of it. We try and keep those to around 15, 20 minutes on our Fridays, if that. So with that, I think we're ready to go to some question and answer. And so again, if you have a question, I want to be clear. I don't know that we're going to be able to get to everyone's question. We're going to get to as many as we can here in the next 15 minutes or so as part of it. Fill out the note card, turn it in. Even if we don't get to your question today, we're going to collect all of the questions that you have had. We're going to do two things. You just heard me say we're going to try and answer as many as we can today, or if not today, on Friday, on our All Things Advocacy update on Friday as part of it. In addition, we're going to publish responses to a majority of them, or to group them together on our AARP.org/ND advocacy page sometime later this week or early next week. So again, if you have questions, put them on a note card, flag down a volunteer, make sure they get in, because we want to make sure we collect as many as we can. So with that, Janelle, let me get the questions open as part of this. And I opened the wrong box as part of it. And let's see if we can get into the questions as part of it. And so the first question, we're going to come from our Grand Forks site. So again, the beauty of doing this in the 4 different areas is we can see there's questions from all of the different sites. And again, a big thanks to our staff and volunteers who are helping feed questions in as well. The first question comes from Grand Forks. The question is, what is being done with the teacher's retirement fund? It's not PERS. So that's TFFR, not PERS. Anything being done there?
You know, that it's been a topic of discussion because, you know, the bill has to be considered, or the budget has to be considered. But right now that fund is doing remarkably well. They made some investments, you know, early on to make sure that funding stayed whole. So there's no changes being made to that. That fund is looking really, really good in comparison to the PERS fund. So there really hasn't been a lot of discourse around that issue. So
right. Next question, we're going to jump from Grand Forks, go down Highway 2 and go over to Minot, to our friends in Minot. There's a question here from Minot that says there's a proposed increase in the speed limit, about increasing the speed limit on the interstates now. I know we've looked at this bill, but from moving it from 75 to 80, any plans for us to weigh in on that?
You know, we didn't weigh in on the first half, and I think we'll continue to monitor it, where we really want to make sure that folks are safe on the highways and on the roadways. And what we have weighed in on the past is the seatbelt law, the primary seatbelt law. And that bill actually was introduced this session too, and has passed as well. So ultimately, we haven't weighed in on it. I think we'll just continue to watch it and make sure if there are any updates, we'll let you know. So. Yeah,
and do know we have great partnerships and great relationships with our friends in the AARP North Dakota Driver Safety Program. I know, in fact, Pete Kuhn was in Grand Forks today helping out. He's probably up there as part of it. And if I haven't shared that bill with him yet, it'll certainly be on the list of things to talk to them about as well, to see if they want to engage as well for that. So with that, the next question I'm going to jump to is from here in Bismarck. So I'm going to come down Highway 83. So I'm making a loop as part of it. And the question is, property tax for me went up over $1,000. Why don't we get a break on property tax? Would help stay in my houses. So you maybe just want to reiterate again about a little bit about what we've been focusing on and touching on, and then maybe kind of, if you can, maybe just give folks a little bit of a broader discussion on what's happening in the tax realm there.
Yeah, taxes is always a hot issue, but again, what we're focusing on is really that homestead property tax credit, making sure that we can expand the eligibility, making sure that the amount of the tax credit increases. And again, this helps you stay in your house longer. So as your property taxes go up, we want to make sure that you can to get that property tax credit. You know, there's other bills that are being considered. A couple of them that didn't pass this session would have freeze property taxes altogether for folks that are 65 and older. And again, not that we have an issue. We don't necessarily think that would be a bad idea, but we really think where we want to make sure that our efforts are supporting is really that homestead tax credit. But there's a lot of conversations about, property taxes continue to rise. How can the state kind of offset that? What is the partnership with local political subdivisions? Where does that lie? And I think that's the second issue that's probably going to keep the legislature here till the very end. Not just retirement security, but how do we look at property taxes in the bigger picture of the budget? So.
Yeah, absolutely. I'm going to jump now down Interstate 94, and we're going to go to our friends in West Fargo who submitted a question. I think it's a great question. Does the insulin cap for public employees include public employee retirees? So Senate Bill 2041, just for reminders, the insulin cap on the public employees system, does it apply to public employees? Do you know? Because if not, I can jump in. If your health insurance is through the public employees retirement health system, and assuming, and that's a big assumption because there's a long way to go yet this session. If that bill ultimately gets passed by the House and then signed into law, if your insurance right now is through the public employees retirement system as a retiree and you continue to have it, then that $25 cap on insulin or insulin supplies would apply to you. If you are on Medicare, know, as we touched on in the video earlier, that you already have a $35 out-of-pocket cap in Medicare that was passed as part of the work that we did on the federal level last year as well. So it's ultimately dependent upon what your health plan is as part of that. So with that, let's jump into the next question, and we're going to come back to Bismarck now. And the next question, sorry, I had it and it's jumping. So the next question comes from Bismarck is, when is the next AARP day at the Capitol?
Oh, you guys loved it so much they want to come back, right?
Yeah.
We were so excited. We had, almost 80 people that came to the day at the Capitol. That was in the middle part of January. So even though it was cold, we won't have another official day at the Capitol until the next legislative session, but that doesn't mean you can't be there every day with us. Your voices help make our voices louder at the Capitol. You're welcome to come. That's what's great about our legislative process. Yep. Anybody can come and sit in a committee hearing and listen. You can visit with your legislators as they're in committee or walking through the hallways. You can watch things online. So there are other ways that you can be involved, even if there's not an official AARP day at the Capitol. So there won't be another one until next legislative session. But please, as Josh said, the cards on your table give you ways to reach out to us. You can find the information at our website as well as other things. But we still encourage you to be involved, even if it's not an official day for us. So.
Yeah, absolutely. Again, I want to make it clear, if you're going to be in Bismarck or you'd like to come to Bismarck and like to be engaged as part of that, we always invite you to do that. You can always reach out to myself or Janelle directly, our contact information on our website, or get a hold of somebody in the room and let them know you're interested as part of it. And if you're here, we'll gladly take you up there and talk to your legislators and other legislators about the issues important to North Dakotans 50 plus. So the next official AARP day at the Capitol probably won't be until next session. But again, we will happily make any day AARP day at the Capitol if folks are interested in coming up as part of it. But that doesn't mean you can't stay in touch and stay in contact with your legislators at home. In fact, sometimes that's even more important as part of it. And again, follow along every Friday at 2:30 about what's happening and what's most recent on the AARP YouTube page through All Things Advocacy, or make sure that you're signed up for our emails. Janelle sends out a summary every Friday as well. And then anytime anything's pressing that we need urgent action, we send action alert emails out through that email system. Again, there's a flyer on your table to do that. I want to jump to Grand Forks. I think this is a great question, and this is actually something I might put a tickler on that maybe we need to do a little tutorial on going forward, maybe for an All Things Advocacy down the road if we have a little bit slower. But question from Grand Forks is, how do we find out how our state representatives voted on these and other bills?
Yeah, we don't officially track that, but you can go onto the North Dakota Legislative Council webpage, and that is a fantastic resource. What you can do is and we can put, we'll make sure that in the follow-up email you can go to that page, but you can search by your legislator, you can search by bill, and you can go and you can track and see exactly how they voted on any particular piece of legislation if they were present that day. So the legislative website is very interactive. And that's the best way to find out about how your particular legislator voted on an issue.
Yeah, absolutely. So with that, it looks like we got about time for probably maybe 2, maybe 3 more questions as part of that. But I want to emphasize, if you have a question, and we're not going to get to all the questions in, but I don't want that to hinder you from submitting a question, put it on a note card, make sure it gets to one of the volunteers as part of that. We're going to take a number of these questions. There's some great questions. I wish we could get to all of them, but we're going to unfortunately run out of time today to do that. But we're going to do 2 things again as a reminder. We're going to post them on the AARP.org/ND advocacy page. We'll probably group them so like questions we'll handle together. In addition, on Friday, I believe that will be March 3rd, which is the next All Things Advocacy at 2:30 p.m. on our AARP North Dakota YouTube page. We'll be live again with All Things Advocacy on Friday, and we will get to what I will call a mailbag. So it's these questions, anything you want to submit between now and then as well, and try and answer as many questions as we can there as well, because I think it'll be a little bit slower this next week for that as well. So a couple more questions here before we send you off on your way. Next question comes to us from West Fargo. I think it's a great question as well. Relates to our helping to present consumer fraud and exploitation. Is there any service or department that can help a person who has been the victim of a romance scam or a support group of some type?
Yeah, we didn't talk about them today, but we've got a really good partnership with the Attorney General's Consumer Fraud Protection Division. So, the bill only was really limited to financial crimes. But right now, if you've been a victim or a potential victim or know somebody around romance scams or, other scams, you can contact the Attorney General's office, the Consumer Fraud Protection Division, and report that, and they can help you walk through the process in terms of if you do think you have been one or you suspect something has been fraudulent. That's an excellent resource for you, available right now.
Yeah, I think the second one is the AARP Fraud Watch Network, AARP.org/Fraud Watch Network. There's a number of resources, including a hotline there that you can call and talk to trained volunteers who can help you as well. The last thing I want to emphasize is if an individual is a victim of a scam or fraud, report it. I think it's so important to make sure that gets reported, because if it doesn't get reported, it can't be followed up on, it can't be investigated. And that simple act of reporting often helps us and others notify others that this is going around, because if it's happening to one individual, it's very likely they're trying to commit that crime on others in the area as well. So AARP.org/Fraud Watch Network, or get a hold of the North Dakota Attorney General's Consumer Fraud Protection Division. So with that, I think we have time for one more question. I thought there was one back here. Sorry, I'm bouncing between a couple of things as part of it. This is one that came from Minot, and interesting. It's a great intersection between our state work and our federal work, because the question is, I believe, asking specifically about state, but the good news, so the bad news is there's nothing on the state level. The good news is there's been some federal action to do this as well. And so the question is from Minot: is there any legislation proposed that helps make hearing aids more affordable?
Well, you already gave the answer away.
I know.
But no, there is no legislation offered in the state this session that would make hearing aids more affordable. But what we do know is that most recently, you can purchase some hearing aids over the counter. And that was our work at the federal level.
That's
and
right.
I think that's so important for people to realize, is that these systems often cross over, and they really work together. So some things that aren't offered and addressed at the state level are addressed at the federal level. So hearing aids were made more affordable very recently by the Biden administration, that you can get those over the counter for certain hearing loss. So
yeah, absolutely. With that, I just want to say thank you for submitting those questions. Again, if you have a question, do not leave without putting your question on one of those note cards and getting it to one of our volunteers and our staff. I'll commit to you on behalf of our team that we'll do our best to get answers to as many as we possibly can. And if we don't, we'll certainly refer you to places where you can hopefully find answers or information for that. Janelle, before we get out of here, I want to give you maybe 30 seconds to just touch on kind of what you're excited about in the second half of the session.
I'm excited to see where things end up, right? We come in with some big goals. And I think anybody that's been part of a legislative process before knows that you're not going to win everything, and that can be somewhat disheartening. But I think what happens in the second part of the session is you can still have those conversations, and you can still figure out that might not have worked, but there may be other solutions that could get you closer to your goal. So I'm interested and excited to see what else we can accomplish. I mean, we've been super successful already this session. But I think this is the long-term vision, and this is where the endurance kicks in, right? That you really have to sit for the long haul and know that there could be some great changes that happen, even though they didn't happen the first session. So.
Yeah, absolutely. So a couple things, and then we'll get you out of here and let you get on to enjoying the rest of your day. The first of which is I want to say a huge shout out and thank you again to all of our volunteers here in Bismarck, West Fargo, Grand Forks, Minot. We literally could not have done this without you. When we were planning this, we were trying to figure out how to make sure we provided information in those larger communities where we typically have done events to do it, and without killing Janelle, quite frankly, and the rest of our team being able to do this. So thank you to them. If you haven't, give them a round of applause. Thank them on your way out. It's appreciate it. Additionally, I want to thank my team, specifically Doreen, even though she's not here, for getting all this set up, finding locations for us. A huge shout out to Wendy and Marnie, and as well in terms of each of them are at different sites right now, managing the sites, but they were also huge in helping promote and making sure you knew about the event, as well as Wendy made sure all the food was where it was supposed to be today, and hopefully went off as well. And then last, I want to say a big thank you to Janelle. Janelle's been working overtime for you all as part of it. She's been spending lots of early mornings and late evenings, especially the last few weeks at the Capitol. So thank you to Janelle. But I want to end on this. We are where we are because of you. As Janelle said, it's those emails, it's that pressure that comes from you at home. We'll continue to try and do our part to make sure you know what's going on at the legislative session. And we'll continue to be that fierce defender and wise friend at the Capitol for North Dakotans 50 and older. But it really is you all weighing in that helps tip the balance in our favor oftentimes as part of it. And so I just want to say thank you as part of that. And so with that, this has been the AARP Legislative Lowdown.